does birth control have a negative impact on fertility?
So there are a lot of different types of birth control, and let's go through them and let's answer this question. Birth control, most people are talking about the birth control pill or combined oral contraceptive. The birth control pill is a type of estrogen called ethinyl estradiol and a type of synthetic progesterone. Both of these are synthetic compounds that are working in your body so that your brain does not send out any FSH. If you don't send out any FSH, the ovary is not going to have an egg grow. So those eggs still come out of the vault that month. Just nobody ovulates. So they all die. And then next month you have another group come out. Birth control doesn't change the trajectory of your rate of loss of eggs, how many eggs you have available, does not cause you to go into infertility. Like, that is well proven. There are other times in your life where you will have a similar pattern happening. So just to say, being pregnant, for example, when you're pregnant, your placenta is making a ton of estrogen. The brain won't send out FSH. And so you still have eggs coming out of the vault.
Goodness.
They are all going to die.
Can we just get a break of the eggs
I know.
always
Well,
coming out of the vault?
when you lost the majority of your eggs, well, it was when you were a baby, from 20 weeks gestation till birth. But after that, the next greatest loss is from birth until you start your first period. All of those years where you were never going to need them, you were rapidly losing them because you had more in the vault. So you sent out more every month, yet the brain wasn't turned on, because puberty is actually the brain turning on and starting to send out FSH and LH, which then stimulates the ovaries. We always think about the secondary sex characteristics that come from puberty, but really it's a brain activation of maturity. But the point here is that that's a natural process in women, that you are going to have eggs come out of the vault in periods of your life where none of them are going to be stimulated to grow, and they die and another group comes out.
Do you think that one of the biggest game changers could be is maybe like some sort of pharmaceutical intervention to like tell the eggs not to do that, or slow down at least so it's not so wasteful?
It would be wonderful, right? And women often falsely think that if they're on birth control, it could do that. So I see both ends of the spectrum. I see people say birth control causes infertility because, it's decreasing my egg count. And I see people saying, oh, it's preserving my fertility because I'm not ovulating eggs that month. It does neither of those things, right? The eggs are on their own trajectory. They are coming out of the vault. We do not have a current medical way to influence that. I do think that will be a huge medical breakthrough, and people are looking at that. Like, that is of high scientific interest due to the fact that if we can help the ovaries, the longer you make eggs, that's when you make estrogen, right? Estrogen is only made from the ovary when an egg is really growing. So if we want to preserve your longevity and preserve your natural estrogen, we're going to help you go into menopause later. So that's a huge thing that people are looking into. We don't have it right now. I think there's been some hope that like rapamycin could be that. But right now we don't have that option or that thing that we can do. Birth control pills, I will say though, they have their own side effects. They impact your gut health. They impact your libido very often. They impact some of your other tissues. That ethinyl estradiol is not the same as your natural estrogen.
Yeah.
You can have a variety of side effects. They're not for everybody. What we do see right now is a huge generation of women who were put on the birth control pill for a true medical reason.
Mhm.
It was never diagnosed, right? They had really heavy, irregular periods. They went in their early 20s. Their doctor said, here's the birth control pill. That'll help. They say, okay, great. Take the pill for 10 years. Stop it in their early 30s because they want to get pregnant. And now suddenly their body reverts back to what happened before the pill. And they're having irregular periods, heavy periods again. And a lot of people are calling this post-birth control pill syndrome, or they're really attributing these new gynecologic problems to the pill, when really the pill was just a Band-Aid. It was you weren't having a real menstrual cycle. If your menstrual cycle is a vital sign, you didn't have it. So we weren't allowed that opportunity to get to the bottom and get to the root cause before you were placed on the pill. And I do think modern medicine's done a huge disservice to women by not trying to do that little investigation or even talking to people. Like, I know there's patients whose doctors thought, you must have PCOS, so I'm going to put you on the pill. But they never said those words to the patient, right? And so when she stops the pill, wants to be pregnant, doesn't have a period for months, and then gains weight, gets acne, it's this huge hormonal cascade that a doctor probably knew would happen, but the patient was never given the opportunity to know that or be an advocate. Because of this, I do think it's important to say that I think you should stop the birth control pill at least 3 to 6 months before you want to be pregnant so that you can have opportunity to track your cycles. It's not that long because it lives in your body. The pill is extremely short acting, but it's because we want to have a few months of a cycle pattern. And if things are not normal, I want you to get in and get evaluated. Before we end the birth control talk, not all birth controls are created equal. So hormonal IUDs are extremely popular. They're a very effective way to not get pregnant. These are things like Mirena, Kyleena, Skyla, and they are a progesterone-only birth control that goes intrauterine. The nice thing is you don't have to think about it. Another nice side effect is because the uterus is not accustomed to being exposed to progesterone every day. When it is, it antagonizes the estrogen impact of growing a lining, meaning the uterine lining thins out. You often can have very light cycles or no cycles at all, which many women love that about an IUD, right? If you're young, don't have periods, many women love that side effect. However, it can take a really long time for your body to see unopposed estrogen and get it to the point where a lining will grow back. So if you have an IUD, a progesterone IUD, and you have very light or non-existent periods on that IUD, and you want to be pregnant in the future, I definitely want you to remove that at least 6 months before you want to be pregnant, because it might take some time before you really get that lining built up enough to what it needs to support a pregnancy. And the last thing here is we'll also see the Depo-Provera shot, which is injectable progesterone. This is at exceedingly high levels of progesterone, much higher than your body would ever make, such that it prevents you from ovulating for up to 3 months. So we've probably heard about the birth control shot. You go in and you get it every 3 months. Totally shuts down ovarian function for 3 months. Then you need to get it again to prevent ovulation. But it has been shown to prevent ovulation for up to 18 months.
Goodness.
Okay, and so not in enough people to call it contraception for 18 months, but it's definitely not something that you should be using if you want to be pregnant in the next 2 years.
Wow.